out of control. The Ebola outbreak spreading fast.
The fears of an outbreak escalate.
Doctors and hospitals on high alert.
It is a disease proving difficult for healthcare workers and governments to handle.
You get the feeling that now it is anything and everything people are talking about. Welcome, everybody. I'm glad to have you. I'm Neil Cavuto. And it is getting a little scarier by the moment as the number of health scares from Ebola continue to rise far from Africa. While in Atlanta, another American infected with the Ebola virus arrives on U.S. soil. And now growing concerns, this killer disease could, I stress could, be mutating. Something that Dr. Ernest Patti said is a real threat. He's the senior attending physician of emergency medicine at St. Barnabas Hospital in New York City. Doctor, how real a threat is that, and why would it matter?
Well, the thing we have to remember are viruses are pretty hardy little creatures, you know. Common cold is a virus, influenza is a virus, and over time, they've both mutated at different times throughout history and caused different types of outbreaks. So it's something that we need to remember. But common sense has to dictate, and we have to, you know, not panic and flip out, but mainly try to keep a watchful eye on it and see how it spreads in the next few months.
All right, the fear people have, Doctor, with this Ebola is that if it mutates and becomes an airborne type of thing, all bets are off. How likely is that? Do we ever see indications of that with something that isn't necessarily, you know, taken up via, you know, airborne, but that could?
Well, the chance is always there that it could become an airborne type of virus. I mean, you know, like I mentioned earlier, I'm not an expert in infectious diseases, but watching these types of outbreaks over the past years, you know, it's interesting to note the earlier outbreaks of Ebola were fairly contained quite early. And it just seems like this one is spreading a little more, you know, further. Is it possible that it's spreading not just through the direct contact that was mentioned? Is it possible that it's, you know, slowly mutating and becoming airborne? I guess that possibility
Let's say
exists.
It does then, Doctor.
Sure.
How does that change things?
Well, it changes things because coughing, sneezing, where you can spread these types of particles through the air where they travel further distances, is going to increase the likelihood that it can affect more and more humans in a quicker fashion. You know, more of like the outbreak scenario.
Right. That is something that a lot of experts have said is very unlikely here. But as you said, in Africa, it was relatively contained, particularly in Liberia, where apparently it all started. It was relatively contained, but that was until it extended beyond Liberia.
Right.
And I'm wondering, I'm told by other doctors that there might be a lot of people out there who are not exhibiting any of the symptoms that would get them kicked off a flight, for example, but who later might. Well, how do we know?
There's really no real way to know. I mean, the problem with Ebola is it exhibits symptoms that are similar to many other viral diseases. You know, the malaise, the headache, the high fevers, the nausea, the vomiting. These are things that you get in practically almost any viral disease. And especially folks coming from malaria, we have to make sure that they're not suffering from malaria, which you get many of the same symptoms and characteristics from. So we have to rule out the malaria first, but also keep in the back of our mind that is it possible it's Ebola. Today with air travel, the problem with air travel is, as convenient as it is for us, it also allows infectious disease to travel so quickly between countries.
It's like a petri dish.
Exactly. I mean, in the old days, in the 1600s, you know, we spread disease via, you know, long ocean voyages on ships, and explorers spread disease that way. Today, any citizen can spread disease by just getting on a plane.
Well, you know emergency room work and all of that. How do you think those caring for, let's say, for someone who comes in with the Ebola virus?
Right.
What precautions should they take? Are they likely to take?
Well, fortunately, we practice every day standard infection control precautions. You know, we do isolation for patients with fever, rash, things of this nature. So obviously, we have to look and see if a person comes in exhibiting these signs and symptoms, has been in one of the affected areas, say within the past 21 days, that should put us on high alert and allow us to maybe isolate them sooner. The quicker you recognize it and isolate that particular person, we put on our protective gear.
But Doctor, what if, to your point earlier, that we don't know that this person is waiting in the emergency room with 100 other people, only later exhibits these symptoms? In that interim, he or she could have risks contaminating others, right?
He could have. So what we do then is we always have lists of who's on shift, and we get those folks and we bring them in for evaluation. I mean, these are what we call exposures. You know, we have the safety practices in place, the thing is we have to remember to practice those safety practices.
So they all have to wear these hazmat suits, I'm saying? Or no?
Well, not necessarily hazmat, but I mean, simple things like hand washing, covering your cough when you're cold, wearing masks if a person is sneezing or coughing in the waiting room. Simple act of putting a mask on someone who's coughing can cut down dramatically on the spread of infectious disease.
Dr. Patti, thank you very much for joining us.
Thank you very much.
I know
for
you're a
having me.
pretty busy guy, so we appreciate it.
My pleasure.
In the meantime,